Television. I am Olasumbo Mudupe. We bring you Sound Health every Tuesday and we try to highlight trending health issues from around the world. 50 children die every hour as a result of gastroenteritis, an intestinal infection caused by contaminated food or water. This is our focus today. The conversation begins after this break. Please stay tuned. The program is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Toni Adeyemi, consultant public health physician, and she is going to tell us what exactly is gastroenteritis in children. Good evening, Dr. Adeyemi, and thanks for joining us.
Good evening, and thank you for having me.
All right, Dr. Adeyemi, according to UNICEF, about 500,000 children under the age of 5 die every year. That's about 50 children every hour. Tell us, what exactly is gastroenteritis in children?
Okay, so basically, gastroenteritis is an inflammation of the gastrointestinal system. The gastrointestinal system consists or comprises of the stomach and the intestine. So when we have gastroenteritis, the stomach and especially the small intestine are affected, and then they start shedding their lining. So basically, that's the definition of gastroenteritis. The common symptoms that occur with gastroenteritis is diarrhea. And diarrhea is the passage of loose watery stool. We usually use the frequency to determine if it's actually diarrhea. So once the stool is more than 3 times in a child and is loose, it's watery, it's classified as diarrhea and most likely as a result of gastroenteritis.
Okay, tell us, what causes gastroenteritis in children? Because ordinarily you feel, okay, why would a child stool for more than 3 times, children under 5 years of age?
Okay, so the main causes of gastroenteritis could be viruses. So we have viruses, we have bacteria, we have parasites, and then we have other causes. So under the viruses, the most common virus that causes gastroenteritis is the rotavirus. We have other viruses, but rotavirus is the most common. And then other bacteria as well. We have things like salmonella that causes the typhoid that some of you already know about. We have salmonella as a form of bacteria that causes it. And then other parasites. We have one parasite called Giardia lamblia, so that also causes gastroenteritis. Some of the other causes could be, especially in children, could be lactose intolerance. So there are a lot of children that their stomach can actually not, they resist lactose from milk. So anytime they are given milk, it causes lactose intolerance in the body, and then it presents as diarrhea. Then we also have some drugs like antibiotics. So when some children are on some antibiotics like Ampiclox and Augmentin, it can also irritate the stomach lining and cause gastroenteritis. So apart from these causes, we now have predisposing factors. So these bacteria, viruses, and then the protozoa, how exactly do they get to these children? So basically, it's from hygiene measures. So drinking or eating of contaminated food or water is a major predisposing factor to gastroenteritis, because that is what will introduce either the bacteria, the virus, or the protozoa into the child.
Okay, thanks for clarifying the types of gastroenteritis in children that are available. Now tell us, you mentioned diarrhea as one of the symptoms, constant visitation to the toilet and vomiting. Are there other symptoms a mother or caregiver should look out for in children?
Okay, so basically, the symptoms of gastroenteritis, there are three major symptoms. So the first one is nausea, the second one is vomiting, but the most prominent one is the diarrhea. And diarrhea, as I described it, or as I explained it to be, is the passage of loose, watery stool. So the stool has to be loose and watery. So if your child just passes stool, like maybe 3 times a day, and is semi-formed or formed, that's not diarrhea. Or if your child passes loose stool, maybe twice, that's not diarrhea. But when your child passes loose stool frequently, and that frequently is up to 3 times and more in a day, then the mother has to be watchful. That's indeed diarrhea. And then the other symptoms, when it's now associated with vomiting, is associated with nausea. The child feels like vomiting, but it's not from vomiting. Those are the symptoms of gastroenteritis. But for the diarrhea, diarrhea also is associated with dehydration, because when a child has diarrhea, the child gets dehydrated. So there are signs to also look out for mild dehydration, moderate dehydration, and severe dehydration, because the moment a child is having moderate to severe dehydration, that child needs to present at the health facility immediately.
Okay, does color matters now in terms of the discharge? Maybe could it be brownish or greenish?
So for the color of the stool, when we're making a diagnosis of gastroenteritis, at that point in time, we are not looking at the color of the stool. So, but for the healthcare provider, the color of the stool can give you an indication to the organism that is responsible for that diarrhea. So as a caregiver, as a mother, once you just see that your child has frequent passage of stool, present at the hospital. But there are some that are danger signs, and the danger signs, especially when they are passing loose watery stool, the moment you see blood in the stool, it could be an indication of dysentery. So yes, that even if it's just one passage of stool, but you see blood inside, then yes, you need to present at the health facility immediately after. Some of the stools are greenish in color. When they are greenish in color, the child is still passing it frequently, so it's still an indication to present at the healthcare facility. But the color is left to the healthcare provider to already have an idea of the bacteria, of the virus, of the parasite that is causing the gastroenteritis, so that they can know the right medications to prescribe.
Okay, I'm glad you mentioned earlier that lactose intolerant could be one of the causes of diarrhea in children. We've also seen cases where some parents say teething could be the cause of diarrhea. Can you please clarify this? Some would tell you this baby is stooling, but it's as a result of teething. Could this be possible?
Okay, so teething is a basic normal phenomenon that every child will go through. That's just the process of eruption of teeth from the gum of a child, of an infant especially, that's a child below the age of 1 year. So typically what happens during teething is that there's inflammation around the gum area, and then the tooth is trying to erupt. That causes a lot of discomfort for the child. So what the child does usually at that time, they do a lot of gum rubbing. So apart from using their hands to rub, their hand which they might have used to crawl, because teething usually occurs from like 6 months and above, when the child is mobile, the child is crawling. So apart from using their dirty hand to rub their gum, they pick up anything, even the table, chair, anything, even slippers, especially slippers, dirty slippers, so they use it to rub their gum. So it's the process of putting these contaminated things in their mouth that introduces the bacteria or the virus that causes gastroenteritis, and then they start purging, they start stooling. So it's not the teething that causes the stooling, but is what's the aftermath of the teething, which is putting contaminated or dirty things into the mouth at that age that causes the stooling. There are children that would actually sit and not stool at all, because the parents are taking proactive measures to ensure that they don't put dirty or contaminated things in their mouths.
That's an old myth you just dispelled now, Dr. Adeyemi. Thanks for that. So tell us, how do you prevent this condition in children?
Okay, so the first thing is vaccination. So because I mentioned that the most common cause of gastroenteritis in children is a virus called the rotavirus vaccine. So the federal government has been magnanimous enough to introduce, it wasn't on our immunization schedule before, so now it has been introduced into the immunization schedule. So all children born in Nigeria, they receive the rotavirus vaccine at 6 weeks, 10 weeks, and 14 weeks. So this helps prevent the child, especially when the child becomes 6 months and they are moving up and down and putting things in their mouth. It helps prevent them against coming down with gastroenteritis. Then also, because I mentioned that predisposing factors to this are hygiene measures. When there's poor hygiene, either poor hand hygiene, poor personal hygiene of the caregiver, or poor environmental hygiene, it can predispose to diarrhea. So there has to be a lot of health education to our mothers, the caregivers of those babies, to ensure that they take adequate precautionary measures. Wash their hands properly. Hand hygiene is very important before preparing the food of the baby. Wash hands properly. Wash all the utensils that the baby is going to use to eat. That's the plate, the spoon, the cup. Wash them very well. And in places where you can even sterilize, go ahead and sterilize all the cooking and eating utensils of the child. Also ensure that your environment is very clean. Your water, the water you use to prepare the food for your baby or your child, ensure that you boil that water, because boiling has been known to kill some of these bacteria and viruses that can actually cause diarrhea. So environmental measures, first of all, personal hygiene, hand hygiene, and then vaccination for rotavirus in particular.
All right, Dr. Adeyemi, tell us, is this condition infectious or contagious? Because you said stooling is also part of the symptoms as well as vomiting. So tell us, is this infectious or contagious among children being looked after by a caregiver?
So the only way diarrhea can spread, maybe from one child to the other, is still through the caregiver route. So for example, now you have a child in a daycare, a crèche, who is using diaper, or maybe does not even use diaper, but most likely most of them will be in their diapers, has loose watery stool. So the caregiver comes, changes this diaper for this child with a loose watery stool, doesn't wash her hand properly, or washes it but does not wash it properly, and then goes over to try to feed another child with her hands that's already contaminated and soiled. So that way it's possible for her to transfer the bacterial virus that she might have encountered from changing the diaper of a child with diarrhea and feeding another child without proper hand hygiene. So that's the basic measure in which it can be transferred from one child to another. But directly child to child, it's not likely, because the person that is going to do the transfer must have gotten contact with the stool of the infected child.
Okay, apart from treatment at the hospital, are there basic first aid tips you can share with mothers at home or caregivers to stop especially dehydration? Because you mentioned dehydration is a red flag in gastroenteritis, in children rather.
Oh yes, certainly. There's home remedy and home treatment for gastroenteritis. So the home treatment for once you find out that your child is already passing loose watery stool, and I remember I said anything more than 3 times in a day has passed loose watery stool, then that's diarrhea. You need to start rehydrating the child immediately, because the child will have lost a lot of fluid, would have lost a lot of electrolytes, and that would make the child very weak. So you need to start the home remedy immediately. And this home remedy is very simple. It's what we call the oral rehydration salt, or the oral rehydration solution. It's sold widely in all pharmacies and chemists around. And then you can also make it at home if you intend to make this ORS at home. To make your ORS solution at home, basically what you need is 1 liter of water, half teaspoon of salt, and then 6 teaspoons of sugar. You ensure that your water is very clean. Because preferably boil your water, so you're sure that you're not even introducing further contamination to your child. So you boil your water, allow your water to cool, and then mix the half teaspoon of salt and 6 teaspoons of sugar into your water, and then make a solution. And then you start giving the child to sip. Remember that the child might be vomiting. Vomiting is plus or minus a sign. So that's why you have to give the child in graded sips. gradually so that you don't trigger more vomiting. If the child is not vomiting, then yes, let the child drink it at will. But please note, once you make this solution, this oral rehydration solution, it can only last for 24 hours. Don't store in the fridge to use the next day. Once it's a day already, discard. If the child is still stooling, you make another one and give the child. But once you start noticing signs of moderate to severe dehydration, then ORS alone can no longer take care of that child. You need to take the child to a healthcare facility so that the child can be properly assessed by the doctors, and then if the child needs intravenous fluids, they can now pass fluids intravenously.
All right, your call to action as we wrap up now, Dr. Adeyemi.
Okay, so my call to action is just to re-emphasize the preventive measures. And the preventive measures, as I've said, the first one is to take advantage of the immunizations that have been made available by the federal government at no cost to you at all. So you can actually go to any primary health care center, secondary center, or tertiary center where immunizations are being given, and ask for, if your child has not received the rotavirus vaccine, ask for the rotavirus vaccine. Remember I said it's given at 6 weeks, 10 weeks, and 14 weeks. So it's when the babies are still very young that it is given, because it is more useful at that time. So the first thing, if you haven't gotten, if your baby has not gotten vaccinated against rotavirus vaccine, please present at the nearest primary health care center for this. Secondly, exclusive breastfeeding, as we know, is what we always advocate for. And so try to ensure that your baby is exclusively breastfed, only breast milk alone, no water, for 6 months, because this helps build the child's immunity against things like gastroenteritis. And then when you now want to start complementary feeding at 6 months, try and observe all the sanitary measures possible. Personal hygiene, your hand hygiene, wash your hands before you prepare food for your baby, wash all your baby's cooking utensils, and then finally, teething, as I said, does not cause diarrhea directly, but when your baby is teething, try to get some of these teething toys, clean them, make sure they are always clean. There are some that can be kept in the fridge so that it has a cooling effect, so that your child always has something cool and then something clean to use for their gum rubbing, so they don't put dirty things in their mouth. So at this point, I think I'll just end it now and just say that diarrhea is very common in children. However, we can make serious efforts to try to prevent them from having it. And even when they have it, have your home remedy at home so that it doesn't progress to severe dehydration. Thank you.
All right, diarrhea is one of the symptoms of gastroenteritis in children. However, teething does not cause diarrhea in children. Seek medical help early enough. Thank you so much, Dr. Adeyemi, for your time and expertise on how to prevent gastroenteritis in children.
All right, thank you very much for having me.
Sound Health continues with trending health report from around the world. Please stay tuned. Well, this is where we say thank you on today's episode of Sound Health. Remember, vaccination or immunization is key for your child's well-being. You need to vaccinate your child against all diseases. Rotavirus or rotavirus vaccine is one of such vaccines that would give your child maximum protection. You also need to embrace proper hygiene. For comments and inquiries, or you have topics you would like us to treat, please send SMS to 08035826603 or follow us on social media at Lagos Television #Sound Health. A sound health is a sound mind. Make healthy living your choice.